Okay, I'm gonna go through skull positioning real quick. So usually for the skull, we do either a straight PA, which means the tube is perpendicular, or we do a Caldwell, which tends to be a little bit more common, and that has a 15-degree caudal angle on it. So for the PA, you're gonna have your patient put their forehead and nose on the board. So I just asked them, go ahead and put your forehead and nose right on that board. You want to angle your tube 15 degrees towards the feet. Now sometimes you have issues with your patient's height, so you might have to set them down. We want to center with our central ray exiting at the nasion. So you're kind of looking here through the side to see where the central ray is exiting. Make sure that it's right on the nasion. I'm going to raise my tube up, my bucky up just a little bit. And then I'm going to put my right marker on the right hand side. Now, when we're doing the PA Caldwell, you want to make sure that the patient's orbital meatal line is perpendicular to the IR. So from the outer canthus to the EAM, that imaginary line should be perpendicular to the IR. That's going to make sure that your petrous ridges are in the lower 1/3 of the orbits. So you'd have your patient stay just like that, and then you would take that image for the PA Caldwell. All right, and then I would go into my lateral. So for all of the images, you're going to be 10 by 12 lengthwise, except for the lateral, which then you're going to be crosswise. So I'm going to turn my image. My central ray is going to be 2 inches directly above the EAM. And we're doing that to ensure that we get light above the top of the skull. This is going to raise up. Usually we do the affected side. I'm going to do the right side or the left side just to make sure that you can see everything. So I'm going to change my marker, make sure it's on the anterior side. I want to make sure that my patient has no rotation or tilt. So I need to get directly in front of them and look at them, and then I'm going to have you tilt your head that way just a little bit. Their interpupillary line should be perpendicular to the IR, so an imaginary line between their pupils. There should be no tilt or rotation. And then their IOML should be perpendicular to the front edge of your cassette here. So you want to make sure that you get the top of the skull and the posterior portion of the skull on there, and you'd have your patient hold nice and still just like that. Then I would turn them around and put their back up against there, and then we're going to do the AP Towns. So for the AP Towns, we use a 30-degree caudal angle. We're going to have the patient tuck their chin down towards their chest a little bit. And then what we want to do is we want to make sure that the orbital meatal line is perpendicular. So you're going to come right in here and again take that imaginary line. Can you tuck your chin just a little bit more? Sometimes we can actually put a sponge behind the patient's head to help them. A little less. Okay. All right, so making sure that orbital meatal line's perpendicular. And then I want to center 2 inches above the glabella, which happens to be, for most people, at the hairline. And then I want to make sure that I'm centered to the mid-sagittal plane, so I'm going to scooch her just a little bit that way. Lower this down a bit. All right. And again, it's important to make sure that you have light above the top of the skull so that you're not clipping everything, especially with that large angle. So I'd have my patient hold nice and still just like that. And then the last one I would do is the SMD. Do you think you can do that standing up? Mm-hmm. Usually you have your patient about 12 inches away from the board. And then, this is more down. You want to make sure, again, that the IOML, the inferior orbital meatal line, is parallel to the IR. You're going to center 3/4 of an inch above the EAM, or usually, I'm going to move you just a little bit, right in line with the gonions of the mandible. This is really difficult for your patient to hold, so you want to make sure that you're hurrying. So I have my patient hold nice and still just like that, and then when they're done, you can just help them right up. So that's it for the skull for this week.